An SGR fix this year? We'll see. Welcome to the July 29th edition of Policy and Practice, the weekly podcast from IMNG Medical Media. I'm Alicia Alt.
And I'm Mary Ellen Schneider. Some physicians and software companies are seeking to delay the Stage 2 meaningful use requirements. And on Capitol Hill, Republicans are doing their best to stop the Affordable Care Act. But first, a bill to eliminate the SGR is moving through Congress. Legislation that would finally put an end to Medicare's sustainable growth rate formula has cleared its first hurdle. The bill was approved by a House Energy and Commerce subcommittee last week. The next stop is the full committee, which is scheduled to address it this week. But lawmakers have yet to discuss how to pay for the $139 billion fix, and that could trip up the legislation when it gets to the House floor.
So far, doctors seem pretty pleased with the bill. The American Academy of Family Physicians and the American College of Physicians applauded the bill's plan to increase pay every year for the next 5 years. Cardiologists welcomed its emphasis on paying for quality. Thoracic surgeons said they were glad to see that registries like theirs would be allowed to access Medicare claims data. But many of the same groups warned about a provision that would cut doctor pay for so-called misvalued codes. That part of the legislation needs to be reworked. That's according to a letter to Congress from the American Medical Association and 8 other medical societies.
Over in the Senate, health IT was a hot topic. Senators heard complaints from doctors and software makers who say the Medicare meaningful use process for EHRs is moving too quickly. John Glazer with the medical technology firm Siemens said physicians and hospitals need more time before moving on to Stage 2. He proposed delaying the Stage 2 start from October 2014 to October 2015. The combination of Stage 2, ICD-10, and preparation for new payment and care models is just too much, he said.
We may be creating a perfect storm that has potential to overburden eligible hospitals and providers of all sizes. Hospitals and providers may choose to opt out of the program. There is evidence of this, as more hospitals and providers have indicated they will not attest to Stage 2.
Meanwhile, congressional Republicans want to slow down or just plain stop the ACA. Several House committees peppered the administration with requests for more information last week. They want to know more about why the employer mandate is being delayed and how much premiums will cost through federally run health exchanges. The legislators said answers are needed before the law is rolled out any further. Some House members and senators are now saying they won't approve federal agencies' 2014 budget requests unless their congressional colleagues stop all funding for the ACA.
Expect that funding battle to continue into the fall. This week, we'll be keeping our eye on further hearings on the ACA. And that's the Policy and Practice podcast. I'm Mary Ellen Schneider.
And I'm Alicia Alt.